Hello. This presentation is about postpartum hemorrhage, and I'm just providing some continued education that was brought to our attention following our recent Joint Commission survey. So in 2022, the Adventist Health System released a postpartum hemorrhage policy, and it was rolled out with great success and was noted to streamline the care that we provide to these obstetric patients that have postpartum hemorrhages. However, after our recent TJC survey, there were some things that were brought to our attention that needed to be clarified in order to help staff provide care for these patients and better streamline our current process. So this order is found under nursing communication, and this is what is currently under nursing communication for all our laboring patients and postpartum as well. So it basically says activate stage 1 postpartum hemorrhage subphase if you have a vaginal delivery that has greater than 500 cumulative blood loss with continued bleeding, or for cesarean greater than 1,000 milliliters with continued bleeding. This slide just shows you what the order says in its entirety because it was cut off in the previous screen, but this is how it looks in Cerner when it's put in. I highlighted the words continued bleeding because this verbiage is used here. I think it's very important that we start to use that in our charting, because as we do more QBL, we will find that we will have a greater number of patients that exceed that number 500 for vaginal birth and exceed that 1,000 for cesarean birth. But I think we need to address continued or not continuous bleeding in our charting, so that when surveyors look at review these patients' charts and there's auditing done, we can actually paint a better picture, because not every patient that has greater than 500 for vaginal birth is technically, are they truly hemorrhaging? Are they truly unstable? We only know that if we put more in our charting as far as, is the patient continuously bleeding? Are they stable, etc.? And so I think we just need to make sure our charting is reflective and painting an accurate picture. And including that verbiage will help to clarify exactly the condition of the patient at the time that you're caring for that patient. So what does this mean? So when you go to, when you're taking care of these patients and they have that excessive bleeding, and you go to put these orders in, based off of that nursing communication order that we just talked about, you can put in a stage 1 postpartum hemorrhage subphase, which gives you additional orders in order to provide care for that patient and be practicing within your scope of practice. I will say that if your patient is stage 2 or stage 3, you would have to put in the previous stage as well. So if your patient is stage 2, then you would need to put in the orders for stage 1 and stage 2 so that you get all the orders that correlate and that patient needs to provide good care. And then for stage 3, you would put in stage 1, 2, and 3. This is simply a screenshot of the orders that you would get when you put in that subphase. So this is subphase 1 for stage 1 postpartum hemorrhage. This is stage 2 postpartum hemorrhage. And this is stage 3 postpartum hemorrhage. I will say that when you put in a stage 3 postpartum hemorrhage, it is often associated with a massive transfusion protocol, but please be advised that the stage 3 postpartum hemorrhage subphase does not automatically start the massive transfusion protocol. So if you need the massive transfusion protocol, you will still need to put that order in so that you can get that blood ready that you need for the patient.